clutch mug. Everyone now knows what I need for Christmas. So if people want to get me Christmas presents, they can get me that mug, either with Cody's face on it or with my face on it.
So my mug at my second location is a picture of me drinking out of this mug. So it's very inception, a coffee mug inception.
So each clinic that you open, you're going to have a different layer.
Exactly.
Of mug.
Mm-hmm.
Well, I hope that one day you're going to need like a giant Yeti mug that's like...
Me too, buddy. Me too.
Yeah. And that's probably what everyone joined us for. But I think we are good to go. I think everyone that's joining and more people are probably trickling in and everything like that. But we teased it there with your coffee mug. But I thought it would be really cool. We can kick off just to start. My name's Ryan Leech. I'm our head of strategic partnership here at Digitail. I also host a podcast called The Bird Bath, where I cover the topics relating to everyone in veterinary news. Every Tuesday, I bring out the top stories in less than 15 minutes so people know what's going on in the industry. But Cody, why don't you give everyone a very brief, because we're going to do an hour here talking about your transition and your time from DVM to CEO, even though you still are a DVM, to give you all the credit in the world. But give them a little background about who you are and what we're going to talk about today.
For sure. Well, the briefest of backgrounds is I'm a veterinarian in Calgary, Alberta. I always joke that my biography takes me an hour to get through just because I love talking about my stories.
Well, another thing, I don't know if you actually know this, but this is a fun tangent of how I was first introduced to the lore of Dr. Cody. So when I first entered the veterinary space, I had a team of salespeople that was working for me, and they said, hey, there's this doctor in Canada that he has like the best Instagram, and he's a large animal doctor. And like, I know it's not exactly what we're going at, but like, if we could ever get him to participate in something with us, it would be so incredible. He's so cool. He's amazing. Like, I can't wait. And they showed me your Instagram. And I don't know if I ever told you that story, but so for the people that I started in Vet World with many years back, if you're watching, we made it, people. We got him. He's here. And now we're going to talk about some cool stuff. So what we're going to hit on is your story of starting as a DVM and how you've transitioned that into becoming a CEO of your own veterinary group. And so if you could start us, just talk first about how what were the decisions like of, one day you were sitting there and, elbow deep in business and decided, let me explore more into the business side of what the veterinary industry has for me.
Yeah, so elbow deep, I thought that was, a cow vet reference joke and not elbow deep in business. But, I think a little bit of the historical context is I fell in love with veterinary medicine at a very young age. I was 16 years old. And the first time I ever walked into a mixed animal vet clinic and the smell of iodine and dog piss permeated my sinuses, I've been forever hooked. So I've always been extremely passionate about veterinary medicine. I graduated from college, went into an associate position, and really did not think much about business. As is, the case in a lot of practices. There was a couple of partners that were 65-year-old plus, and 2 years in, I got the tap on the shoulder to become a partner. So that was my first entrance into the business world. And I found that I really loved it. And I think the reason I really loved it is because it's just part of veterinary medicine, right? I love the history of veterinary medicine. I love the future. I love the news. I love the students. I love the politics. Of course, I love the medicine and surgery, but I also love the business. Like, I just love learning every single aspect there is about vet med. So there's no question it was a very steep learning curve. I was a partner in a veterinary clinic. We were primarily cows. We started to diversify, and I started consolidating mixed animal practices up here in Canada. So we started purchasing these rural mixed animal practices. And it was actually in 2019 I had divested completely out of those partnerships. So in 2019, I was free to the world to redefine what I wanted to do. And the very, very brief story, a little bit inside baseball, is at that time I was also traveling around the US with a group of veterinarians. And veterinary professionals. So Danielle Lambert from the Snout
Yeah.
Group, Dr. Dan Markwalder from Mission, and Dr. Adam Conroy also from Mission. Previously, they were independents, and we were going just from like city to city in the US, filling hotel conference rooms with veterinary professionals and talking about business, talking about the business of veterinary medicine, talking about entrepreneurship. And at that time, I wasn't practicing, but I just started getting so excited about the future potentials that existed within vet med. And I was also getting a little bit frustrated because I was like, there's all this endless opportunity that exists within our profession. Why isn't anybody doing anything about it? And I'm not saying that nobody was, but I was, conference room after conference room talking to these companion animal veterinarians about like how amazing of a tool the internet is and marketing, and all of my video and social media background. Like I saw this incredible potential, and I finally just said I'm gonna do it myself. And that was the true genesis of FenVet. Is I think there's a better way to reimagine how we offer our services to the world.
Well, thank you. I mean, you're definitely taking on a big piece and a big part of what I think the industry needs. If you look at the overall scope of, I know consolidators are looking to rebrand now as vet groups, right? So I'll use the broader term of, if you look at the scope of veterinary groups across the industry, there are not DVM CEOs at, put an asterisk next to this number, but I think any group that has over 25 practices, I don't think that there's a DVM that runs the entire business. And so a lot of veterinarians are reluctant business people, I think, and you came at it in a different way. You were um, an engaged and excited DVM that then dove headfirst into the business ownership. And something that you and I talked about earlier this year was something I thought was super cool, was that you actually put out your business plan.
Mm-hmm.
You are wanting and encouraging other DVMs to maybe not follow in your footsteps, but know that there is not a wall in front of them on that first step, which for a lot of people is the business plan, especially if you haven't looked at business before. What was the decision like for you to say, all right, here's something that I built and researched and really dove into and understand, and here's the playbook of hopefully how you can make something successful. What was your idea of bringing that out to and giving that away to people?
Yeah, for sure. So I think that just came from a lot of veterinarians like to contact me. I've got a very public profile, and FenVet, what we created and how we created it, and the story we told as we were creating it, I think really inspired a lot of business owners or veterinarians that wanted to be business owners to learn more about that story. So I get contacted daily from veterinarians across the world looking to do something different, to scratch that entrepreneurial itch. Even locally. So I was being contacted by local veterinarians, and they'd be like, "How do I even get started?" And I just fell into a cadence pretty quickly of like, "Here's my lawyer, here's my accountant, here's my realtor, here's how you build a clinic, here's my business plan." Here's my banker. Like I was just giving them everything because like, why not? It's anybody who's done this knows that anybody can start a clinic. So I'm not worried about, there being all of this additional competition or anything like that. Like that's 1% of the battle opening up the doors. It's the everyday grind is what I love and what I operate on and what I succeed at. So I wasn't worried. And I remember putting that business plan together and there was just no resources out there. I was frustrated that, like, how is there not a companion animal practice guidebook that exists out there already? So I just wanted to put it out there because nobody should waste more than 45 minutes putting together a business plan. And a business plan is just something that's, supposed to be concise enough and have enough data points in it to trick a banker into giving you money. Like, it's not like something that's super crazy. Now, I do think that mission and execution on strategy is extremely important. If you're going to put any time in, it should be into that, which of course is incorporated into the business plan. But like, yeah, why would we not want more entrepreneurial veterinarians existing out there in the world?
So you keyed this up. It's almost like I sent you the script. I don't know if you saw my list of questions before, but one of the things that I think sets FenVet apart, and is probably the intangible that is, why you can give away this, why business people write books, because anyone can read the book, anyone can read the plan, but it takes sort of a soul behind it to want to do that. Why, or what was the decision that you made for positive workplace culture as a major part of that business strategy?
No, absolutely. So the first thing was mission, right? I really, really started to understand as I operated businesses how important mission is. And I feel like the veterinary industry is still yet to come to that realization that a mission is actually the answer to every question you will be asked as a business leader, or every question your team will be asked as customer service providers, as employees, as coworkers. It is the literal blueprint to everything that you're going to do. And when you look across the industry and you look at the missions that are on websites, they're very generic, and they don't actually, like, no organization actually truly follows them. So for me, I had to understand that and put into place our mission, which is a reimagination of the veterinary care experience. That's what I wanted to do. I set up FenVet to be my 30-year career play, my last and final career play. And I know when I talk to some of my friends, they always laugh. But like, that was what I wanted to do. I had this clean slate. I had industry experience and I had a lot of passion. So I wanted to do something that I love for the rest of my career. So in that, I wasn't happy with the status quo. I knew there needed to be a paradigm shift, a reimagination of how we looked at veterinary medicine and how we offered those services, how we interacted with our colleagues, how we unfurled that customer experience. So for me, it's not, I didn't reimagine the veterinary care experience on day one, and this is what we do. What our mission is we're reimagining the vet care experience together as a team, as a community, as a group. And because it's important, because I think that there's still a lot left on the table, because I don't think that society is 100% satisfied with how we provide our services and what we do. And our teams aren't 100% satisfied in the cultures we create. So that was the mission, was reimagination of the veterinary care experience. But you need a backbone. Like, what are you doing?
Right.
And for that, I laid out 7-star customer experience, exceptional practice culture, and innovation. And how I came to that conclusion was I just did the blue ocean strategy on a piece of paper in the Mojave Desert while I was drinking a Coors Banquet beer. I had read the Blue Strategy book, which gives you this exercise where you just list out everything on an XY axis. So along the X axis, everything your industry does. It doesn't matter if you sell mattresses or pillows or tires. You just list out everything your industry does. And then on the y-axis, you just rank, does your industry do this really well or really poorly? So I wrote down medicine and ranked it really high. I think veterinary medicine as a whole does a really good job. It's what we're trained to do. You give us tools, you give us teams, we can do a great job at medicine. So I'm not going to go out and make a business that's the best at medicine. That would be insane. Same thing with surgery. Same thing. I wrote down dog food sales. I'm like, well, like, yeah, okay, the industry is moderately good at dog food sales. I'm not going to build a business based around dog food sales. And I just kept listing things out, grooming and boarding and everything that we do. And I wrote down the word customer experience and I ranked it really, really low. I think that we have not done a great job as an industry really, truly thinking about the customer. And right beside,
Let me ask you, just to interrupt you, but where did you rank taking care of the team or
yeah.
the?
So that was right next to it. So I wrote down
Oh, there you
customer
go.
experience.
I looked at your notes, I guess.
So I wrote down customer experience, ranked it super low. I remember the moment crystal clear, and I wrote down the word culture, and I just stared at this graph, and I just ranked it at the bottom because
Yeah.
I'm so disgusted at what our industry, the current state of our industry is.
Mhm.
These, the burnout, all of the issues, the people just the cycles of negativity, it looked in 2019, it looked like an absolute disaster to me. Everything that I saw in every practice, every veterinarian I talked to, I'm not saying there wasn't ones that were good and there's not ones that were great, but there, as an industry whole, as an average, I was like, whoo, we got a lot of work to do there. And I
Yeah.
just circled those things and I was like, okay, here's my core strategy. I think innovation is important. If you're going to do a reimagination, you're going to need innovation as part of that. So innovation has always been a core strategy as well. But it's innovation of thought. It's not necessarily innovation of like, we have to have all the coolest technology, which we do. Like we love, the integrated AI in our radiology. We love the integrated AI in our practice management software. We love
What is that practice management software?
on this great one called Digitail.
I've heard good things. I would recommend everyone check it out.
It's I know this is not a plug, but it's revolutionary. Like it truly is revolutionary to see how my veterinary teams interact with practice management software now. It's bananas how they're able to, like, medical records are no longer an issue. Like they're
Yeah.
just not. So it's been wild to. I'm so happy we incorporated that. So that's FenVet. I should not be the one sitting here. I was a cow vet for a decade, and I'm a hillbilly from Northern Alberta. I grew up on a cow farm. You want to know something, Ryan? I didn't walk into a small animal clinic until I walked into FenVet. I've never been in one. I have no idea what they're like.
But that's maybe I think that's part of the thing that's interesting though is when we look at things, I'm very obviously I'm not a DVM, but I hope to be able to bring my understanding of different business methodologies and things that are happening to be able to improve the life of what's happening within the clinic. And maybe that's kind of sometimes what it needs. It needs someone with the scientific and mental understanding of the practice of medicine that you brought, but then also a fresh perspective of the understanding. And to give Danielle Lambert and Snout and all of those other partners too, probably a lot of credit as well for their vision of, the willingness to talk and listen to people and hear what's going on. I think that's probably where you've seen some success as well. You didn't come into it and say what all of us hear every day when we're beating our head against the wall is, well, we did it this way, or this is how our software worked, or, oh, do you have this shortcut, or can we do this? This is what we've always done. Perhaps it's that vision of, well, I know what the level of medicine needs to be. I know what the care needs to be. I know how to qualify metrics. I need to know how to look at things. And now I can apply that to business. There's always something that when I was previously with Dr. Ivan and I were working with different consolidation groups. And the thing we would ask a lot of them was, how do you measure those mission? Like if your mission is to take care of your team and your employees, if you're not measuring what you're doing to take care of your employees, if you're not looking at the tenure of your employees or the employee NPS scores or those sort of things, can you really say you care about people, right? If you're not measuring it, can you really care about it? What would be a couple things if someone's listening and they have their own practice or they're thinking about their practice? What's one thing where you would say, this is not a reimagination of your entire business, but you could imply one thing that you could, leave this and go after the lunch break right now and say, guys, what we're going to do from January 1st onward is that we're going to have this feedback loop or this cycle or this conversation or this sort of tool within the team. What do you think would be something people could do on the culture side?
Yeah. That's really, really hard to do. It's like looking for the silver, looking for a silver bullet,
Yeah.
and all of this is so multifactorial. What I would say instead is I think we would do well to incorporate a mindset of just thinking for ourselves in every decision that we make. What is the best possible way that we can do this in the year 2024? Anything, right? What is, just think about your phone systems. Think about the customer journey when somebody calls you. When was the last time a practice owner thought about that? Because what we now have is just like an adoption of what everybody was doing in 1992, right? You just have somebody call the clinic and there's somebody sitting at the front, and they're trying to check somebody in, they're trying to sell dog food, they're trying to book an appointment. We have phone trees, we have this response. Is this an emergency, or can you please hold? Nobody's ever thought about that ever again. So just like go back to first principles and think like, is there a better way? And that's really just how we built Fen. Is I took none of the industry's old ways of how we do things. When it came to practice management software, I spent hours and hours, days and days, trying to make sure that we were finding the best possible solution for the year that we actually live in. What is the best way for us to incorporate those phones? What's the best way we can greet our clients? What is the best way that we can activate our community? On and on and on. So that's what I think that the thing that a practice owner should go into is the next decision they make, forget everything else what the rest of the industry does, and just think, what would the best possible way to do this? How do the dentists do it? How does Amazon do it? How does Zara do it? Like, you could go on and on and on.
So so I want to take us down a different path a little bit here. So what we titled the webinar was From DVM to CEO. And I think what we've started our conversation with is from DVM to leader or incredible founder, right? Let's talk about some of the CEO type stuff, some of that business owner, business running type view, and some of the higher level, enterprise type decisions that you're looking at. So when someone's, we have a ton of clients, especially with Digitail, that are new practice owners or people that are looking at software to think about starting their own practice. What would you recommend for the financial foundations that people should look at, right? What do they need to put together in order to get that initial funding? I know you're in Canada, which I've looked at some of the Canadian funding. I think it's a little more, it's not easier, but it's a little more pleasant, I think, than some of the US funding for starting a new practice. But what do you think are some of the things that people should put together or start compiling as they think about starting their own clinic?
For sure. So I've got a little bit of inside baseball on that. So one of the partners that we had partnered with when I was traveling around the U.S. was Bert Hockenberry. He is no longer at Bank of America, but he was one of the senior VPs of essentially their vet med division. So at least I have a pretty clear understanding what Bank of America looks at.
Yeah.
In my understanding is it's no different in Canada than the U.S. Okay. We are the darlings of the healthcare profession. Banks fall all over veterinarians. Our practice success rate is unparalleled. I think Bank of America's numbers were like 99.8% of veterinary clinics succeed. So for them, they'll fund 100% of this. You just need to put together a cohesive business plan. You have to have a clear vision of what that's all going to look like for yourself. The business plan part is so easy. You go to my LinkedIn, you copy paste. I've got the financial analysis spreadsheet down at the bottom that you just plug in. How many square feet is your building going to be? What do you roughly estimate the build out going to cost? What do you need for equipment? How are you going to start in terms of your total employees? Are you going to start at 1 vet or 2 vets? And the spreadsheet does everything for you with the projections out to 5 years. That's all. You don't need to get too crazy with this. It's really, really simple. Banks love veterinarians. They love entrepreneurial veterinarians that have a great vision, that want to just build a space in a great area. Like it's that part is so incredibly simple. Um, is it nice to have, I would say more granular than that. One place where I've seen a lot of struggles and is I think it would be great for a future practice owner to save some cash so they can stop practicing at their associate job and just focus on the build out and focus on building the team. And I get there's a practicality. I know lots of veterinarians that continued their associate positions right up until their practice was ready. But it is really challenging to work a full time clinical job and then also build out a clinic off the corner of your desk. So it's really more time management than money management. But
Is
the
there
financing's so easy.
is there a you know I am a self-described terrible accountant. In my accounting class in college, I remember on the final, I was 10 cents off on a balance sheet, and I turned it in, and I told the teacher that that was close enough for me for real life. I did not do well. That was not how the answer that they were looking for. But we're talking about all these skill sets the DVMs have. They don't teach accounting in vet school. Is that something that you would expect another another person to be able to come in, or is that somebody that you would want to add to your team, or should that be a fractional type role? What do you think should be done there so that people have good financial metrics on their business?
For sure. It's really just finding partners, right? It's finding a great lawyer, it's finding a great accountant, finding a great realtor, finding a great designer, and a great builder. This is all that you need, right? So your accountant will be able to take care of everything for this for you. You're going to have an accountant anyways when you set up the corp, right?
Mm-hmm.
So you set up the corp, you interview a few accountants, you find one that has small business experience. It's great if they have some veterinary experience. That's the easy part. Somebody that you can call and ask questions. You don't need to know anything. Is it great to do your research, to look at it, to understand for sure? But this is what you surround yourself with great professionals, right?
Yeah.
You can't be expected to know all of this in and out. You just need to find good team members. And in Canada, a great corporate accountant that costs you like $3,500 a year. Like that's not
I need to send
great.
my taxes to Canada. It's different in the US, but yeah, I think that's right. And, to give credit to there's obviously Inspire Veterinary Partners recently went public earlier this year. And it's unfortunately the numbers have not been probably what they were hoping for on the stock market, but hey, that's how things go. But it has been extremely interesting to be able to have another vet group that now has to show all of their work, right? So if people are looking for additional resources, I found it really interesting to read some of the SEC filings from Inspire when they went out, because if you look at their team structure as well, and they're doing not a de novo strategy, they're out there doing traditional consolidation of roll up of acquiring practices, folding them into a larger business and doing that. But their legal team is outsourced, their accounting team is outsourced, their operational team is outsourced. The majority, their corporate overhead is extremely small, which allows them to utilize the revenue from the practices to continue to do acquisitions, which I thought was pretty interesting. And it sounds like maybe not completely different from how you're looking at some of those things with FenVet, to be able to say, yeah, you don't, we're not a $100 billion business. We don't need a full retainer of lawyers. We don't need 15 accountants. Like, let's get someone that knows what they're doing. We can hire an outside party to help us with these, and probably call the other practice owners in your area and ask them who they're using for accounting, because people like to. I've found the veterinary industry likes to help each other, especially veterinarians practice to practice.
Yeah, for sure. Like if anybody calls me locally, like I said, they get my lawyer's email, they get my accountant's email, they get my realtor's email. There's your team. You've just got the best team. I found out the hard way. I had to go through some duds before I got to the gems. Structurally, so I haven't had a chance to talk about this publicly. So I wish I could, take a moment of kind of how we layer this.
Yeah, please, whatever you think is important. You're the boss here.
So it is pretty simple, but one of the things that I'm most proud of that we've done that I haven't talked about is our practice leader role. So, I came into FenVet not knowing what to expect. And literally 7 seconds in, I thought I was going to be leading a practice. And all of a sudden, I was practicing full time. I had hired a veterinarian to do the vet work. And there was, we opened during COVID. There was this meteoric rise. Our books were full, literally day one, 7 seconds in. Oh crap, I guess I'm practicing full time until I can figure this thing out. So from that transition back out of clinical practice. So currently today, this week, I'll maybe see a handful of appointments, but I'm not currently, practicing 25 appointments a day. I spend all of my time as the leader, right? As the CEO of these practices, making sure that we're adhering to our mission. That's all that I do.
Hmm.
What is our mission? How are we adhering to it? How are we executing on our customer experience? And how are we executing on our culture? How are we executing on innovation? This is all that I do. When I moved to a second location, I was really, really worried about how that transition was going to affect the team, right? I needed to replace myself as, the clinic leader. So I moved from this role as veterinarian to then clinic leader to then no longer being there full time. But I asked one of my technologists if she would be interested in becoming a practice manager, and she said nope. And I said, why? And she said, because I've never seen it work before. And I found that really profound and really, really interesting. So I probed into it more. I'm like, what do you mean? And she's like, it's never worked. She's a career technologist at multiple different practices. She saw it time and time again. A senior technologist getting the nod to become a practice owner and completely changing, being a problem with the culture, there being so many issues, them being pulled too thin, them still practicing on the floor. There's so many different responsibilities, and I thought for the first time, you're right. Oh my goodness, the industry has not done a great job in building out a practice manager role. Like I'm on the no offense to anybody in their group. I'm on this Facebook group that's Practice Managers Unite or something like that. And I follow along, and I just shake my head thinking, like, what a disaster. Like, what a complete dumpster fire, that's going on across the industry. And it is not the practice manager's fault. It's, how they've been set up for failure by the practice owners, by the corporates, the vet groups, I should say. So I sat with that, and we talked a lot about that together of like, what are the problems with the practice manager role? And then I just distilled down, like, what does a practice manager functionally have to do? What's the most simplest way to make it as simple as possible? And what I realized is all a practice leader needs to be able to do is to say yes or no. That's the fundamental thing that you need one person in the clinic to just say yes to something or say no to something. And we've made it really simple because we just say yes or no based off of our mission, right? So she's essentially being the leader of this practice by making sure that we're adhering to our mission and our core strategies and saying yes or no to things. She's essentially affirming, yes, this is in support of what we do, or no, this is not in support. She does not practice. She does not do anything with marketing. She does not do anything with human resources. She does not do anything in terms of bookkeeping. She does not do inventory. She does nothing besides leading the practice. The amount of mental load that we put on practice managers to make sure there's toilet paper, to make sure the social media marketing's done, to make sure the payroll's done, to make sure, she does none of that. We've delegated that to the rest of the team. I don't do any of that either. The rest of our team has specific roles where we make sure that the practice leader, we don't even have a practice manager. I hate the term now. Our practice leader is just able, with a clear mind, to be able to steer the ship in the direction of our mission. I haven't talked about that before, but I think it's one of the most innovative things that we've done to date, to redefine what a practice manager should be within a veterinary hospital.
That's, I mean, that's very interesting. It's definitely something that, I guess if we're looking for something that people can try to implement, is maybe look at what that job description of your practice manager is and where that overlaps. And there's a ton of resources out there as well right now. I mean, there's the, um, within the AHA technician utilization guidelines that were just released, the practice manager role is situated in there as well. There's the overlapping of CSRs. There's the utilization of AI to be able to offload a lot of those things as well. One of the questions that we got in the chat that I think ties a bit into some of that employee and some of the structure that you've put in place there with the practice leader is, how are you working with sort of employee reviews and as well as that employee satisfaction, and perhaps if you're open to discussing how the compensation fits into that for your teams?
Yeah, no, absolutely. So that is definitely a role of myself and the practice leaders that we do have. So that's the job. They say yes or no to things, and constant focus on the team, one-on-ones, check-ins, reviews, all the time, constantly, just over and over and over and over and over. When it comes to compensation, it's really, really simple. So we have really transparent compensation as people come in. This has been one of the most fantastic hacks that I've ever found in my life, for hiring people. Is I just post on Facebook, Instagram, and LinkedIn the transparent compensation of every single role when I need to hire somebody, and I get literally hundreds of applicants, with no like fancy writing, no creative copy, nothing. It's
Mhm.
like, now wanted, client care coordinator, $21 an hour. Here's the benefits. Email us. It works so incredibly well. When it comes to compensation, what we do is very simple. We do a cost of living increase annually. So we just look at what that is, and we do a cost of living increase for the support staff, and for the veterinarians, we just do production based compensation. So not production, but we utilize looking at the metrics of production to be able to see when they're ready for a raise. So, I target at that 20%. We've got really great compensation that effectively works out to about $25,000 additionally. And when a veterinarian is producing higher than what's targeted, then we have the conversation. It doesn't have to be annually, but what it's not is there's no negative accrual. There's no penalty for not producing. If they're not producing, that's my fault. That's me not providing them the support, providing the accurate schedule. How can you pay somebody on production when you do a de novo in the first year? Like, that's it.
Right.
It's my
Yeah.
decision to do a de novo. It's my decision to see how effectively we market. So there's no pressure or any sort of, hey, look at this. When they get there, we talk about it. We're open about it. We talk about efficiency. We talk about optimization. We're targeting. We're looking at metrics, but it's just production-based compensation for the veterinarian. So if they produce $1 million, then they get $200,000 plus benefits.
Great.
Super straightforward and simple.
Awesome. So I guess the thing that you put out there that was kind of interesting is, FenVet is looking to grow in a de novo model. For people that aren't familiar with that term, de novo is just fancy Latin speak and business people talk for building something new, right? Adding new locations, as opposed to growing a practice or growing your footprint by acquiring other practices. That's the two ways that we see groups. So acquisition or de novo. FenVet goes with the de novo strategy. What was that catalyst or that kick in the gut for you to say, all right, when did FenVet go from, I know you said it's your 30-year plan and you're going to be retiring. I hope that it happens either right on day 30 for you, or 30 years, or maybe sooner. And then you can go to Costa Rica with all the rest of the veterinarians that I know that retire. But what was that push that said, all right, it's time for this second location? How did you know, or do you still know, or are you pulling back the reins on that? Like, talk through for people that have a
For
one
sure.
successful location.
Yeah, so I think to peel it back a little bit more, so why de novo versus acquisition in the first place, right? So that was simple. 2019, I was looking, I'm looking at this business plan, I'm looking at this mission, I'm looking at these strategies. I couldn't buy it. It didn't exist. There wasn't a FenVet to buy. And the thing that worried me the most was the culture, right? I had worked on change management. I had purchased 6 practices in my career. I knew that I did not have the skill set to make a mediocre culture great or even a good culture great. I had never done it once in my career. That is so hard to do. And right there in my strategy, exceptional practice culture. So I couldn't buy a great culture. Great cultures aren't for sale. And I did not have the skill set to make a mediocre culture great. I don't know how to do it. I have tried, I've never done it in my life. So I only had one option, and that was to build it from scratch, which I had not done either, but I knew I couldn't do the other thing. So I only had one other play left. I had to build this from scratch. I could go into any hospital and execute on an exceptional customer experience. I could truly do that. I don't think that would be that difficult if the culture was great. You cannot have an exceptional customer experience without great culture. They go hand in hand. You have to have the culture if you want to execute on that customer experience. If it's a poor culture, the clients are going to see straight through it.
Yeah.
So for me, I just had to build it from scratch because nothing else, that I could see existed that looked like it, that fit that core value, that core strategy. And it was 2019. I wasn't going to pay an 18 multiple for a hospital. Like, are you kidding me?
That was a
Guess
good, smart decision.
guess how much the multiple is on a de novo? It's 0, right? Yeah, you got to build out the facility. Yeah, you've got to build the equipment. Yes, you don't have a client list. You don't have any goodwill, on and on. But like, there's no way for the rest of my career, I would have never paid more than a 5 multiple. I understand the math. All the practices I had ever bought previously were between a 4 and a 5, right? And you talk to other small business owners, like even that's generous. Like,
Yeah.
we a 4 to 5 multiple was that existed for most of veterinary's history from the late 90s onward. That was a super fair multiple.
Right. And we're
So
starting to see the shift back towards those numbers. Maybe not the 4 or 5, but I mean, we are seeing under the double digits or very, very low double digits as that valuation for practices now.
right. Yeah, I love going whenever I talk to veterinary students. I love speaking at vet schools, and I always love giving them like a mini MBA on practice valuations because nobody ever talks to them about it. So when it came to building out a second location, it was kind of a factor of a couple different things. So my goal as a business person is to just continue to reinvest in building out FenVets. I love this part. I love the start. I love building out a hospital. I love staffing a hospital. I love watching it grow. It is the most incredible thing in the world to watching new customers come into a new space and just have their minds blown that they've just got such a great, exceptional customer experience. I love watching happy teams, right? I want to do more and more and more of that. So for me, it was just a combination of essentially 3 things. So the first one is, can cash flow support it, right? So obviously you need to have cash that's available to invest in. Not, you get the bank to pay for the build out, but it still costs quite a bit in terms of all of the additional things, including the payroll, until you're at break even, right? Like, you're not necessarily going to be break even day one. So you could be break even at 3 months or 8 months or 3 years. It really just depends on how fast your practice is going to grow. So having available cash flow, having a cushion is definitely important. Bored, like I had done it. I was 7 months into the first clinic, and I was like, okay, like, we did it, let's go on to the next one. When I have an optimized practice, I'm kind of bored. Like, what else is there for me to do? And then the third was veterinary professional interest across the board. I remember being like 2 or 3 months into FenVet. Well, I remember when I launched FenVet, just as an idea, I was terrified to put out my first help wanted ad. I was pretty sure that I was insane. I was pretty sure that I was the only person in the world that looked at veterinary medicine in this light, and that nobody was going to apply. There wasn't a vet or tech or TA or client care coordinator in the world that wanted to pair up with this crazy cow vet who wanted to completely change the world that they lived in. 3 months in, I remember thinking, am I ever going to be able to find another vet? Like, I had found one. I'm practicing full time. I'm looking around the industry thinking, where's
There's always one other crazy person, but
right? There's always
two,
one
right?
other, but then yeah, am I ever going to be able to staff out this hospital? There was probably like a 6 week period where I'm like, oh man, I don't know how hard it's going to be to get another vet. Fast forward to now, right? We've got a waiting list of 28 veterinarians to work at 2 hospitals. Local veterinarians, high
Yeah.
quality veterinarians. We put out a job ad, we can get 100 veterinary technologists locally. We just did one for technologist assistant. We got over 200 applicants in 2 days. So that is also one of those indicators that like shows me like I could do another one. I don't have a veterinary shortage. I could literally turn on 5 hospitals tomorrow and be able to staff them. So that's encouraging. If I was struggling to get veterinarians, I wouldn't be as bullish on opening another hospital
Yeah.
because that's
I've heard
a
that though.
raw product, right? That's the only
Yeah.
thing that we sell. We sell units of veterinarian time.
I've heard from others that are starting de novo groups and building out their own practices that are looking at it as opposed to, well, this is what everyone's done. Let me just stamp this over and over and over again. But people that are putting their own take and their own spin on what's happening, that they say, I'm not seeing a shortage. I'm seeing a shortage of places that people want to work. Now, I will not wade into that minefield too
Come
much.
on. There's not a veterinary shortage. There's no veterinarian shortage.
I personally believe that there is a shortage of veterinarians, and I think that there is a difficulty in the scale and growth that's going to need to happen within the space to be able to fulfill the amount of pets that need to be seen.
Are you a politician?
I should be, but that is, I mean, that is what I see, and I've seen some of the data on both sides. I think that we will see. I think if every employer was an employer of choice, though, we would have people staying in the profession longer. That would ease the shortage. We would have more people that leave and want to stay in practice versus going to alternative pieces. So I think more employers of choice would be a major factor that eases the strain on the shortage or potential shortage or perceived shortage, however people want to look at it.
So we can agree that there is a massive leadership shortage.
Correct. Yes, I think we can definitely see that, and you'll every single week when I'm putting together the bird bath, I have to decide how many stories am I going to cover about the C-suite changing in a large group, right? Because everyone's looking for that right touch and that right group. But you know what? There isn't a lot of coverage on is the importance of those regional managers or those practice leaders, the people that are actually in there every single day, that are working with the teams and really growing with them. I think that's the difficult thing. And I think that's probably where, as people look at this, if you are thinking of buying a practice or building your own practice, both can be wildly successful and wonderful ways to grow a business and take over a business. I think what people will find can be difficult, though, is if you're coming into it and you're acquiring practices and you're buying practices, if you're not spending time hands-on with the people and you don't have someone that has your same vision in the practice, it doesn't matter how long or how much money you spent for it or how much you're paying them. People will only be able to put up with something for so long. So I think that's where the de novo growth model does build a lot of value for people.
Absolutely. And, my comments around there is no veterinarian shortage, it's also layering in the efficiencies and optimization our industry is going to see over the next decade, right?
True,
So
true.
I'm not saying, so I will go on a soapbox and say we currently do have a shortage, or we don't have a shortage. We definitely have a shortage in some rural areas, which is,
Mhm.
a different conversation altogether. But when I look towards the not so distant future, is where I really, really think that an oversupply is very probable. It just because looking at the efficiencies we've been able to implement, if you just around the AI conversation, right?
Yeah,
Like the practice management software capabilities in 12 months are going to blow all of our minds. And veterinarians are just going to be walking from appointment room to appointment room. There's going to be ambient record management going on in the background. Estimates are going to be sent off. Rechecks are going to be automatically booked. Blood work's going to be interpreted. History is going to be already pre-populated. Do you know how much more efficient us veterinarians are going to be?
yeah, yeah. I think, and you know, obviously, I've got the name on the shirt, and we're the ones that put this together. But Digitail definitely is looking at pushing the forefront of that. And I think if people are looking at a way to streamline and grow what their business is doing, there are ways to offload mundane tasks or
For
the
sure.
any and whenever I when I had a consulting business, whenever I would consult with someone or work with any team, if there's something that you do twice the exact same way, you should look for a way to automate it.
Yeah,
And yeah.
here's a great one. My phone team utilizing a voice over internet protocol system,
Hmm.
okay, that has integrated AI conversation summaries. So all of a sudden, they're just having a phone conversation. They end the call. They copy paste that phone summary and put it into the medical record. Now they don't have to type out, "Hey, Mrs. Jones called. Fluffy's still having some constipation." Like that's so much work that they have to
Yeah.
do. And now they're just copy pasting because the VoIP program is automatically referencing the conversation and putting it into then 3 sentences for them. That saves so much time. Like the every step we interact with any of our team, any of our customers, any of the other veterinarians, is just going to get so much more efficient. But I digress.
No, no, I think it's important because this is what people are looking at when they're trying to decide how to run a clinic, where to do, what to push on, what are the important things to do there. And so I think we should definitely, obviously look at those things.
the
We, yeah, go ahead.
Oh, just back to the back to the original question about the growth strategy for me, right? So I'm gonna build another FenVet as soon as I can. If I had if I had the cash flow and the capital this second, I would build another one and another one and another one. If somebody cut me a $75 million check, I would do another 50 right now, just hands down. Like there's nothing else that I want to do. But this is just me. This is just Cody, and you can only do this so fast. I love doing it. I get frustrated. I get frustrated having 28 veterinarians on a waiting list that I can't just open up 5 hospitals in Calgary and move on, right? But
Mhm.
so for me, as soon as cash flow makes sense, then I'll build another one and another one and another one. What we're planning on doing is essentially building out 5 in this city to see if we can actually do it, right? So how do we improve on our systems? How do we grow each phase? Essentially replace myself as the practices leader,
Mhm.
and then move on to a different city just to see if we can do it again. Like I'll do a remote clinic in a different city. My parameters are pretty simple. It has to be a city that has 100,000 people and is a place that veterinarians actually want to live. So it's infinitely easier finding, vets to work in Calgary, Alberta than it would be in, some remote northern Alberta city. It just is.
Yeah.
Veterinarians like to eat sushi and like international airports, and that it's just true. Like
That's
that's
I
just
think
what
that's our
it
quote from the topic. Veterinarians like to eat sushi in international airports. That's
is.
put it on a shirt, right? But yeah,
but
that
it
it's
is.
Yeah, it is easier to hire people where people want to be. And so we have a few minutes left. I want to make sure that I get to some of the questions that people
Yes.
asked. One of the questions that I think was really interesting, you got a lot of people that just say that they love you, which, I mean, I'm not seeing as much I love Ryan's in the comment, but they do love you. But someone was asking, they're in their last year of school as a veterinary student, and they want to start their own clinic. Would you recommend, or have you seen any pros or cons or pitfalls of someone coming straight out of school and starting a clinic, or would you recommend getting some experience into their belt? What do you think they should do?
So it just 100% depends on the individual. So I'll tell you a story. Dr. Alex Pop, Appalachia Veterinary Services. So Alex Pop came to visit me as a veterinary student. He's obviously from the Appalachia,
Mm.
and incredible human being. He's was originally born in Romania. His dad was a radiologist who moved here, had to get reaccredited. Their family were, they just were they were immigrants. They had a really hard life to get started, and he just has Alex has this entrepreneurial spirit. And he came and spent 2 weeks with me. He had a really great rotation, and he was 6 months out in practice. And he gives me a call and he says, "Cody, I want to buy a vet clinic, but everybody's telling me that I'm crazy because I'm only 6 months out into practice." And I said, "Alex, you are crazy. I can't believe you're not thinking about buying 10 practices." It's just who he is, right? Alex
Yeah.
Pop will, throughout the history of his career, he will probably own 20, 30, 40, 50 hospitals. I wouldn't be shocked if he owns 200 or 300 hospitals. He's just wired that way.
Yeah.
He's an entrepreneurial veterinarian who loves leading practices. He's a great leader. So he bought that practice and he's succeeded. He's grown that practice immensely. He's done everything that an entrepreneur should do. So it has nothing to do if you're 1 second out into practice. There's a lot of vets that I know that are 80 years into practice. Well, not quite 80 years into practice, but like should never own a hospital.
Yeah.
They do not have the skill set.
Yeah.
They don't have the drive. They don't have the vision. So there's no issue with doing that. Now, do I think practically it's great to find some, to then if you're interested in that, to go work at Dr. Pop's practice for a year to, learn some stuff from him? Absolutely. Do I think you should, find a way to get into, an entrepreneurial veterinarian's practice, just to learn the ropes and to see how they lead things? For sure. I think there's lots of merit to being patient to some extent, but like if it's in you, then just do it.
Yeah. Well, no, I think that's great. And I think there's a lot of DVMs that become business owners out of necessity, or the reluctant business owners. So I guess my only tip would be, don't do it because you feel like it's the only place that you can work to be excited about where you're working. You can, if you do want to find it, there are a myriad of options of places where veterinarians can be wildly successful and find a cultural fit. So don't just think that you have to come right out and do rotations at the same type of place. But yeah, and then also reach out to Cody because he's, as he said, he's happy to talk to people about it.
Oh, absolutely. I was just going to say that if you're looking for that place where you can just fall in and watch a great veterinary entrepreneurial leader, send me an email. I've got a list. I know some great, like there's so many great ones out there now.
Yeah. So I have one more question for you. I don't think I have time for the long ones, but I'm going to ask you one softball. Where is the name FenVet come from?
Okay, so my wife and I were sitting on the couch. I said we were just spitballing names. I had some stupid names to start with. And I had an ancient miniature schnauzer named Finn. So I said, "What about FinVet?" And she said, "No, that's stupid. What about FenVet, Fia, Emerson, and Neve, my three children?"
Ah,
So it is just an acronym for my three kids' names. And then I thought about Fen, And fen is a biodiverse ecosystem. It's like a meadow. It's like a marshy meadow in a forest. You know, in the UK, there's the fenlands, right?
Mm.
And all through the mountains here in Alberta, you're walking through the forest and you'll come across a fen, this, you know, really rich biodiverse ecosystem. And I started thinking about that. And I, you know, talked to Danielle Lambert about that. And she came up with this term, a modern ecosystem. And for me, the rest of the branding just made sense. Like it was biodiverse, it was biophilic, it was, you know, natural. It was, that's where all our color schemes came from, right?
Yeah.
That's where that the rest of the design, the rest of the branding just fell into place by Danielle saying modern ecosystem. I'm like, that is what we are. So we've incorporated this fen thing into everything we do. We call ourselves the Fennies. We even just a Fenny is a descriptor for anything. There's Fenny toilet paper. That's soft, plushy toilet paper. One ply toilet paper is not Fenny. There's Fenny water. That's super bougie. That's not like Dasani. There's a Fenny smell. There's Fenny people. There's, you know, a Fenny experience. So we utilize the term Fenny all the time now as
Yeah.
this like all encompassing embodiment of our mission and our core strategy. But that's the genesis of the name. It's just my kids' initials, and it just
That's wonderful.
happened to be this like
Hey.
this ecosystem, and the rest was easy.
Well, that's awesome. Well, I am so thankful. I really appreciate you taking the time to join us. I know there were a lot of other questions that came through the chat. So what we'll probably do is get those on there, and maybe we can throw some answers on LinkedIn and some other stuff together to get all those answers out to people. But a
Or
million thank
webinar
yous.
2.0. We can do
Yeah.
it.
Yeah, we'll do it after you open the third one. So we'll
Okay.
keep doing it. Or I might have the doctor from Appalachia do it. You know, he's my next DVM to CEO. So we really
Beautiful.
appreciate it. And to everyone from behind the scenes that helped us put this together and everyone that joined us, thank you so much. And have a great and a happy holiday and a